Psychotherapy sessions are probably the most common treatments that mental health providers perform in their office. So, in today's video, we'll discuss best practices when reporting individualized psychotherapy sessions 90832 through 90838. So, what's up, everyone? My name is Kat, and I am a certified professional medical coder, medical biller. And in today's video, we'll discuss CPT code range 90832 through 90838. In this range, there's pretty much two sets of codes. There are the regular psychotherapy codes, and then there is a code set that has psychotherapy with E&M services performed. The psychotherapy with E&M services performed are add-on codes. And we'll talk about how to report those codes properly later on in this video. So I just wanted to start off by actually defining what psychotherapy is. So psychotherapy is a variety of treatment techniques in which a physician or other qualified healthcare professional helps a patient that has a mental illness or behavior disturbance identify and alleviate any emotional disruptions, any maladaptive behavior patterns, and any contributing factors. This treatment also encourages personality growth and development through coping techniques and problem solving skills. The patient must be included in the session the entire time or the majority of the time if there are other informants involved in the session. And other informants may be parents, maybe caseworkers, it may be friends or other family members, just someone else that's involved in the care of the patient. You can definitely report an individualized session when the session is geared towards the patient. It may just be other people in the session with the patient. You see this commonly in pediatric care, whereas the child is in the session, but the parent is there too. As I stated earlier, this code range encompasses add-on codes. So 90832 is the code set in the CPT code book that depicts 30 minutes with the patient. So it is important to note that these CPT codes 90832 through 90838 are time-based codes. So let's get into some proper coding tips when we are reporting these codes. So these codes are face-to-face codes. So you have to be able to identify or see documented in the medical record that you are spending this time face-to-face with the patient. The time frame for this is really 16 minutes through 37 minutes. And that is for individualized therapy. If you are performing or if your provider is performing E&M services for 30 minutes or 16 minutes to 37 minutes, you will report the E&M code plus 90833. Likewise, for a 45-minute session, the time frame for a 45-minute session is anywhere between 38 minutes and 52 minutes. For the individualized only psychotherapy, you will report 90834. But if you have E&M services with a 45-minute visit, then you will report the appropriate E&M level and then add on code 90836. If you have a session that's 53 minutes or greater, and it's just a psychotherapy session, then you will report 90837. Likewise, if you have E&M services with a 60-minute session, then you will report 90838 as an add-on code to your E&M services. Again, these codes are time-based, but they do have time ranges with them, so that's very important. So for a 30-minute code, 30-minute psychotherapy code, the time range is at least 16 minutes has to pass up to 37 minutes. To report your 45-minute code, you have to have at least 38 minutes has passed up to 52 minutes. And to report your 60-minute code, anything that's 53 minutes or greater can be reported with 90837 or with your 60-minute code. So while we're talking about coding, there could be other opportunities for additional reimbursement, or if you have like interactive complexity, for example, that was performed during your visit. So if you need more information on when it's appropriate to build interactive complexity, I'll link a video that I've done previously talking about interactive complexity. But do not forget that that is an opportunity to get reimbursed additionally, and that will be reported with your appropriate psychotherapy code in 90785. So let's talk about some documentation tips to report these codes appropriately. So these codes are time-based codes and they are face-to-face codes. So it's best practices to report your total time, but it's even better if you can identify a start and stop time in your psychotherapy note. Also, you will need to document each person that was included in the session. And if there are other informants, as I stated earlier, make sure the patient is in the session at least majority of the time, if not the entire session. It is also important to notate your techniques that is used, at least one technique that is used to treat the patient's condition. You need to also document their insight, their behavior modifications, or any supportive techniques that you are using. Also include how the patient is benefiting from therapy and what the goals of the therapy should be. It is also best practices to report the most specified diagnosis possible for this session. Commonly, I see therapists or other qualified healthcare professionals report the patient is coming in today with depression, and depression would be the diagnosis. Well, we have so many depression codes in our CPT book, and if it is not documented to the most specified degree of depression, then we will be defaulted to depression unspecified. So it's best practices if you can tell us if it's a single episode, if it's a recurrent, if it's mild, if it's moderate, if it's severe, if there is psychosis involved, things like that. So just make sure that when you are documenting the diagnosis for that encounter that you are as specific as possible. If any of the diagnoses happen to be in remission, say that. Also, it's important, especially when you're reporting, any dependence codes such as like tobacco or cannabis or opioids, for example, that you will want to let us know if it's just a usage or if it's a dependence or if it's an abuse. There are different codes for each of those. Also, these codes are qualified to be performed via telehealth. So when you are reporting these codes in a telehealth session, you must attest to that you have done this session via telehealth. And that needs to be documented in the medical record. So when you document your telehealth attestation, make sure you say if it was audio and visual or just audio. There are different modifiers that we can append based on if it was audio, visual, or just audio. For example, modifier 95 and the GT modifier are used for audio visual, and modifier 93 is typically used if the encounter was performed just audio. So just make sure you document that well in the medical record so that the coder and the biller can pick up which modifier is more appropriate for this encounter. Now, those are some best practices when you are reporting individualized psychotherapy sessions and individualized psychotherapy sessions with E&M services. A lot of private practice professionals have questions sometimes about what are some good, billing softwares that they can use to document and to build out these services. And I just want to give a few examples of some of the ones that I have, familiarity with. Therapy Notes is a good one. Theranos Notes is also good. Simple Practice is a good software. There is a host of other softwares out there that you should research, but those are three of the ones that I have, some experience with, and I know that are simple to use, user friendly, and have pretty good customer service. And they are easy for the provider and for the biller to both integrate what they need to do in that EHR so that the billing can be effective. Are you looking to grow your team and add a billing service to your practice? As Superior Medical Consultant, we are accepting new providers for our consulting agency. You can visit our website at superiormedicalconsulting.com today to schedule your free consultation, and we will be happy to discuss your billing needs. At Superior Medical Consulting, we strive to provide superior billing solutions for your mental health practice. So, again, visit our website at superiormedicalconsulting.com, schedule your free consultation, and let's talk about those superior billing solutions that you are in need of for your practice. So, in our next video, we are going to be discussing group therapy, psychotherapy, and best practices when reporting the group therapy codes. So, I hope you would join me in our next, best practices video talking about those codes. If you have any questions or any concerns, please let me know in the comments. And if you have any experience with these codes, I would love to hear that too. I want to thank you so much for watching, and until the next video, you have a great day.